Hello, here we are. This is Rose from the Hume Palliative Care Consortium, Aged Care Palliative Care Resource Nurse for East Hume. And you, Sam?
And I'm Sam, so I work in the West Hume region as Aged and Facility Palliative Care Resource Nurse. We have a new series for you for this year 2023. We're going to be meeting some of the experts in your Hume region in which you work and chat with them about the various projects that they have on and any other insights that they have that we feel is relevant to you working in aged care. We would like to start today, however, by just saying a small acknowledgement of country before we move on. So we begin by acknowledging the traditional owners of the lands and waters on which we meet today. We acknowledge that sovereignty was never ceded, and we pay our respects to elders past, present and emerging. Today we have Elizabeth Jenkins, who is our Hume Region Consortium Manager for Palliative Care. So we're just going to get into it and meet Elizabeth. Elizabeth, nice to meet you. Would it be okay if you told us a little bit about your role in the Hume region?
Yes, certainly, and thanks for having me on today, Sam and Rose. So I'm the Hume Region Palliative Care Consortium Manager. The consortium is made up of the 7 Department of Health funded palliative care services in the Hume region. My role, I facilitate the partners working together on strategic priorities that benefit all of the services. So we can reduce duplication, we can share information and resources, reduce costs, and we aim for consistency across the region, consistency in service where we can. And this is done via the consortium executive, and we meet bi-monthly, and they set the strategic direction and then provide some governance around that. And the clinical advisory group I also work with, and they focus on the operational and clinical aspects of any work we do that's going to benefit the region.
Great, thank you. Now I know in the last little while, maybe 12, 18 months, we've been working on, or you have been working on a particular thing that's hopefully going to support and help aged care nurses. It's a referral pathway guideline /guideline that's there to support aged care nurses in decision making about how they go about referring to palliative care. So would you be able to tell us a little bit about that and how it came about and what it looks like, etc.?
Yeah, sure. So we've called it the Collaborative Palliative Care Support Pathway, Residential Aged Care and Specialist Palliative Care. The goal of the pathway is for residents with complex, persistent and unmet palliative care and end-of-life care needs are supported by a coordinated and integrated pathway that's responsive to assessed needs. So there's a number of things that contributed to the collaborative palliative care pathway. We've been, it's part of our strategic plan to look at reviewing and defining some palliative care pathways, and that included people from residential aged care. It also included people with chronic disease, people with disabilities, and underserved populations. So this piece is only it's one piece of a larger piece of work that we hope to work through. Our palliative care teams have been seeing increased referrals over many years, and it's important that we reach those that are in most need at the right time. And so with this in mind, our clinical advisory group have been working on various patient flow processes over the years. And we've been looking at referral, triage, care planning, working closely with our consultancy teams for complex symptoms, and the way we would, say, discharge stable clients, and ultimately aiming to support people to be cared for and receive end-of-life care in their preferred place. So another thing that contributes to the pathway is the implementation of the LDAC care model and the reverse PEPA program in residential aged care in the Hume region, supported by yourselves, Sam and Rose, which amongst other things provides guidance on the palliative approach to care and when a specialist, a referral to a specialist palliative care is needed due to complexity. We also recently implemented a dedicated palliative care patient management system across the region that was an enabler for supporting more consistent approaches to referral and service access. And the general model we have there around the escalation of care within specialist palliative care, where the palliative care consultants support the community teams and the primary carers, that's fairly standard across the region. So the pathway was ultimately developed to bring all of the key parts together and really formalise palliative care collaborative support across the many residential aged care services in the region. It's not a new process or pathway. We've just defined it in a way that we hope supports the primary carers and the residents and the palliative care teams. So some of the key elements, the pathway demonstrates the shared care arrangements, the roles and responsibilities, and the escalation of support for complex palliative care needs. It gives prompts also for when to refer to palliative care and what might be considered complex needs and some disease-specific indicators. What information should accompany the referral? We know that when a referral contains more comprehensive information, the triage process is more efficient and more timely access to care. The pathway or flowchart illustrates, and it is primarily a guide only, it illustrates the escalation of care in line with complex or persistent symptoms and issues, noting that on page 2, you'll see the diagram that the pathway was aligned or was designed on. It's called the alignment of need for palliative care against workforce capacity, which is an accepted model in palliative care, and it's available in the Palliative Care Service Development Guidelines by Palliative Care Australia. The pathway also provides links for electronic secure referrals and other contact information for the community palliative care teams. And we included information about the state-funded palliative care advice service operated by the Royal Melbourne Hospital, which is available 7 days a week, 7 a.m. till 10 p.m. And the advice service is free, it's confidential and available for everyone in Victoria, health professionals, clients, carers. It's open to all.
That's great, Elizabeth. Yeah, I think when you put it in perspective in terms of specialist palliative care, you know, like there's 160,000 people dying every year in Australia, and palliative care service teams can only get to so many of them, and you know they have to prioritise who gets that care. And so the rest of that care falls back on, and if we say 50% of those 166,000 are dying in aged care homes, then that's like there's 80,000 people dying in aged care homes every year. And so it obviously the palliative care teams can't service all of those people, and so this pathway is great to support the people working in aged care to sort of see really clearly what their roles are and how and what they can do. I think it's really great to sort of to have that really laid out. This pathway is really terrific because it's got a lot of information about all the things that people can do before they even reach for the phone, or in our case go to the internet and start that referral process. And it is I think for me it's you know, triaging in any sort of field of health, it's about symptoms and, as you say, as care needs. And so it's always about how complex are these symptoms, what can I do to begin with to troubleshoot, and hopefully Sam and I are the ones that provide plenty of resources for these aged care workers to reach for when they're trying to troubleshoot in terms of symptom management. And then when they say, okay, this is beyond us, we've tried everything we can, we don't know where else to go, and then they can go to the specialist care team. So I think it's great. Yeah, the pathway is really good because it just makes it really clear as to, you know, for that decision-making process.
Yeah, absolutely.
And we will add a link to the pathway with our recording too, so that you can have a little look at it while you're listening to this. And we'll be chatting about what further information you're going to be able to get about the pathway shortly. We were just wondering, Elizabeth, what do you see as like the main benefits of the pathway project?
So I hope the main benefit is that the residents in residential aged care have their palliative care needs met in an efficient and appropriate way, and that support is provided based on their assessed needs and in line with the nature and severity of the symptoms and issues. And secondly, by defining the roles and responsibilities for health professionals and primary carers, that there's a greater understanding of the collaborative nature of palliative care, and we each have a role in supporting residents depending on their assessed needs. And yeah, that there really is support available out there.
Yeah, so it's not just for the residents themselves, it's actually for the health, our aged care workforce too, that they feel supported and they're clear about, you know, who to go to and when they can ask for support, and they can always get support. So, well, in the Hume region anyway, Sam and I, you know, we're always, both of us are very happy to you know, get a phone call from somebody if they're even just thinking, oh, I've got this patient, I'm not too sure whether I should refer them to palliative care or not. You know, we're more than happy to take a call from any of you out there that need a bit of a chat about that.
Absolutely, yeah. We'll provide our details on how you can get hold of us if you haven't already met us, which you probably have, so that you can contact us to get any further information on the pathway or anything around palliative care in aged care. So we'll put our details there. I guess that sort of answers our next question for Elizabeth, really. We wanted to know if staff wanted to know more about the pathway, how would you recommend they approach that?
Yeah, I absolutely recommend contacting yourself, Sam and Rose, if you're looking for information about the pathway, because, you know, you're very familiar with it and part of the development. So that's really great. But not only, I guess, in relation to the pathway or referrals, but also the work you do in assisting facilities to build their capacity to deliver the palliative approach, and working with some of those state national programs, and also the local program that you've been working on with the palliative care champions and things like that. And I think if you're not sure, you know, again, make a phone call to the palliative care team as well as a first step as well. Once you've worked through all of those things around assessed needs and things like that, the palliative care teams themselves can also provide answers to questions and yeah, assist with any support.
That's great. Thank you, Elizabeth. Rose and I have plans to be coming out to see you all again in the Hume region and just showing you in more detail this pathway that we've been talking about today, and presenting a little bit of education around it. So please do look out for that. We'll be putting out some recorded sessions too for those of you that we don't catch face to face, so that you can have a really good in-depth look at what this pathway is that we're talking about, and the information on the document itself, which is very clear and easy to read, but sometimes it's just worth having a bit of a chat about what that means for us as clinicians. The specialist palliative care teams in the Hume region are also having access to this pathway, so they are going to be very familiar with what you're referring to if you reference it when you have a conversation. So please don't be afraid to mention that you've got the pathway when you chat with the specialist teams about this too, so that they know that you know about this tool that you have that we're providing. Did you have anything else to mention, Rose?
Well, I was just going to ask Elizabeth whether she had any parting words for our wonderful aged care workforce across the Hume region. These amazing people that we see on a regular basis.
Yeah, I think we really appreciate how challenging working in aged care is, and how it's been over the last few years. And I think that everyone's doing a great job. I think, you know, the pathway is just a tool. It's guidance it's guidance really for complex palliative care needs and escalation of care. But generally the decision points are based on your clinical knowledge, your expertise, assessed needs, and, you know, they've got to be in line, of course, with the residents and families' wishes and goals. Yeah, we really appreciate how challenging working in aged care is, with the many competing priorities, and particularly over the previous few years. And everyone is really doing a great job. The pathway is only a guide for shared care arrangements and escalation of support for complex palliative care needs. Decision points are always based on the clinical knowledge and assessed needs, and they're in line, you know, of course, with the residents and their families' wishes and goals of care. I guess the more information contained in the referrals to the palliative care service, the more concise and timely the triage will be, and ultimately, you know, more timely care. They're probably the key messages.
Yes, I think that the information, I think PalCare is great for that, the PalCare program that now we have, and the portals are all on the Hume region website, the Palliative Care Consortium website. It's just it's so great for a team to, when they're trying to triage, when they've got all that information in front of them. And this is what I say to anybody when I'm talking about the aged care pathway, is if you can imagine getting a referral from someone and it's just got like a one-liner or a couple of lines, they're not asking for what they actually want, but it's also about all that background information that the person has to go and fish for to even make a determination as to, you know, how urgent this need is. And if that can be delayed by, you know, they might be looking at the referral at 4 o'clock in the afternoon, and then they pick up the phone and try and talk to the person who made the referral, and they've gone home and, oh, I don't know, you know, I don't know what the whole story is. And so that's all. I mean, it can be frustrating, but the worst thing is that it's delaying care for the person who needs it. You know, if there really is an acute need there, an urgent need, it may be missed because all that information is not included. And that's why the PalCare's got all those beautiful tabs across the page. You can fill in all the information that you want. And I think that's a really good message. It's a great message for it.
Yeah, it's easy, it's secure. It's the referral links are all available on the palliative care website for the Hume region. Yeah, so hopefully it makes it a little bit easier.
That's brilliant. Thank you so much for meeting with us today, Elizabeth, and talking to us about the pathway. We hope you enjoyed listening to us chatting about things going on in your region. These are all really relevant to you. This is something that's happening in your area, and we're going to be chatting with many more people who are also working in great areas of the Hume region over the coming months. So yeah, thank you very much.
Yeah, thanks, Elizabeth. Thanks, everyone. Thanks for listening.
Having me.
Okay.